Our broad economic expansion is in its 9th year. But despite the long boom, more than 3 million people in New York State have no health insurance. In New York City, that includes about 25% of the people under the age of 65. Gains in employment haven't helped much. About 3/4 of New York's uninsured have jobs or are dependents of people who are working. The trouble is they get no health coverage at their workplace, in good part a result of exploding health insurance premium rates and the desire of employers to hold down costs. Of course, the worst burden falls on the poor. Community Service Society surveys have found that 30% of the people in some of New York City's least prosperous communities are uninsured. Now, state legislative leaders and the governor have agreed on a plan designed to tackle this catastrophe. If it works, the new law could catapult New York back where it used to be, in the forefront of the movement to provide health care to all. Our guest today is one of the prime architects of this legislation, New York Assembly Speaker Sheldon Silver, Democrat of Manhattan. Welcome, Mr. Speaker.
Delighted to be with you, David.
Well, can you tell our viewers a little bit about this legislation and how it's going to work?
Well, I think we've provided a historic model for the rest of the nation. We have taken the tobacco settlement money, we've instituted a tax on cigarettes, an additional tax on cigarettes. We've taken that money into a fund, and one of the major expenditures of that fund will be to make a dent in the 3 million uninsured people in New York. And what's interesting for your viewers to know is about 2.25 of that 3 million are from families that have jobs. They work and they're not provided health insurance at work. What we've done is raise the eligibility level for a Medicare type inclusion. We used the model of our CHIPS, very successful CHIPS program, which is Child Health Plus, where we have enrolled children into health insurance coverage who are from families that make more than 2 times the poverty level. So that's families making up to $30,000 and a little more, depending on the size of the family. We weren't able to go as high here, but we are at 150% of the poverty level as far as expanding CHIPS, in effect, into Family Health Plus. And that's the program that we developed. It will be a Medicaid-type program.
Right.
It will provide for eligibility for people 150%, families 150% of the poverty level. So a family of 4 in New York City, we are talking probably about $24,000 to $25,000 in income will still keep them eligible for this program. We anticipate that the eligibles for the program will be close to 1 million of that 3 million uninsured, and we hope that at least half of them respond and enroll in the program.
There was obviously another reason. The uninsured and the growth of the uninsured is one of the prime reasons, but this is also important to the hospitals of the city of New York, both voluntary and municipal. Can you tell our viewers a little bit about that, why this was so critical?
Very clearly it's important. I mean, hospital revenues is what hospital services are all about. Right. We have what we call a bad debt and charity pool, where hospitals come to that pool and say, we've provided so much uncompensated care. That's people who have no insurance, that can't afford to pay themselves, they aren't Medicaid eligible, and we've provided these services and we've lost money, in effect, on it. You have to keep us afloat. You have to keep us serving communities and our communities. What this does is it moves the demand. It now takes 1/3 of the people, hopefully, who used to be compensated for in that fashion. People, many of whom had been sued by hospitals and come up, you know, no pay, they have no money, or certainly they've avoided payment. It takes that pool and that hit on hospitals and that hit on government, because government was really the insurer of last resort by providing the bad debt and charity funds, and it now gives us a pool of customers for hospitals, for lack of a better word, that are insured, that can pay for the services. And that's very significant as we go forward.
There's no question. I mean, coming from Brooklyn, everyone knows we have voluntary hospitals there that are in dire straits. Brookdale Hospital, one of the jewels in the crown in Brooklyn for many years, is teetering on the edge, not because of lack of service, but because of this reimbursement problem and the number of uninsured. But let's talk a little bit about the impact on the municipal hospital system. Perhaps the sick man of New York, hospital care, something that's been under steady attack by the Giuliani administration. What will this do for them?
I think it's the same thing.
Right.
It's probably they are the greatest beneficiary. They serve the most dependent. They exist in many of the poorest areas of the city, and they serve more uninsureds than most at this point. So if we can target enrollments, and that's going to be the key here,
right.
How much we expend in getting people to be aware of the program, how much we expend with community groups in terms of getting people eligible and having them sign up. Very significant.
Is there any plan in the legislation around that issue of getting the word out?
I think part of it, I know part of it
Right.
is getting the word out. We've worked with very successfully with community groups in CHIP in getting the Child Health Plus program. Now, in CHIP, you have a captive audience. Many of the enrollees in the Child Health Plus program, now their parents are eligible, even though the children were previously eligible. Under this, their parent or parents are eligible. So there is a natural mailing list, if I may say, of people who have availed themselves of some of the services in providing in a natural clientele that can be reached first, which is why we estimated a greater response of the eligibles in this particular program.
Was there any debate as this legislation went through on the use of cigarette taxes as the way to go? Obviously, there's some concern in communities that I know about that this is a tax that particularly hurts, obviously, poor and working people most of all. It's,
I think you have to weigh it. I think you have to weigh it, David.
Right.
And one of the things we want to do is stop people from smoking.
Of course.
And when you want to stop people from smoking, you don't make it illegal because that probably doesn't stop it. But when you tax it, you may put it out of the reach of some children who won't become smokers to begin with. American Cancer Society has given us estimates on the number of people you discourage from smoking based on every 10 cents increase in the cost. This is a significant tax. There's no question about it. And enforcement's going to be very important so that people don't go to places where they can buy it cheaper.
Well, has anyone talked about what happens if we're real successful and people stop smoking and the revenues from the tax don't produce like we hope?
I would say we probably will have a healthier society, we'll have less medical expenses, and we won't even miss the revenue.
One of the other things that was obviously we were all looking at around this legislation, and it's clearly very important, is the whole question of medical education in the city and state of New York. I think some of our viewers may recognize one of the largest sort of industries and attractions of New York, beyond tourism and the rest, is our healthcare industry. But medical education is the best here in the world. How does that all fit into this legislation?
This was part of the debate, and very clearly I stood very firmly saying we have the best hospital system in the country, if not the world, right here in New York State, and truthfully, right here in New York City. If you go down the rows here, you will see some of the finest medical researchers and medical practitioners in the world. People come from all over the world when they can afford it to come here. I don't think New Yorkers want that changed. I think when they have something wrong in their family, when they have something wrong with themselves, they want the best and the brightest. And that was our commitment. Our commitment was to retain that. And that's what we did by keeping graduate medical education whole here. We continue to have it. And among other things, people we have paid have done research in terms of finding vaccines, finding cures for diseases. New York graduate medical education expenditures have produced that. and we should continue to produce it, and perhaps the only thing we should focus on a little more is producing jobs that are associated with it. When we make a discovery in our research hospitals, we should be able to market that discovery, and we should produce the jobs that market it here in New York, so we have more jobs here.
Well, as a matter of fact, there has been a fairly substantial loss of jobs in this industry, at least on the municipal side for a while. There's been an erosion. Obviously, the hope would be if this works well and the stability returns, we can see some job growth for.
Yeah, well, one of the things I'm talking about is taking the research that takes place in the hospitals and using the commercial end
benefits
of
it.
Commercial value of it to create jobs in New York outside of the hospital industry, the production industry. I can give you an example.
Yeah, I'd be interested.
Roswell Park Hospital in Buffalo, New York.
Right.
Seeing you're a contemporary of mine, David, you know there's a PSA test, which is the state-of-the-art test for prostate cancer.
Yep.
What you don't know is the state of New York owns the patent on that test. Roswell Park Hospital, a cancer research hospital owned by the state of New York at the time, developed that test, the researchers at Roswell. And the unfortunate part of it is New York State gets a small infinitesimal royalty for each test that's produced. But the jobs that go with it, they're in western Michigan, not western New York.
Yeah.
They're produced in Michigan. There are thousands of jobs associated with that discovery.
It's interesting you should mention, I was on the Health and Hospitals Corporation board for 5 years until I was removed.
We won't talk
about that today. But it was interesting as I did the tours. I visited virtually every one of the HHC facilities, and there is this kind of genius going on, even in the troubled HHC system. There was one researcher who I was talking about at one of the larger facilities that has a big emergency room operation. They had developed an ability to do instantaneous x-rays and evaluation of trauma cases. And they were talking, because they had set it up as a computer-driven system, and the analysis was often done by cameras in the first place and monitors in the first place, that they could sell that kind of service virtually anywhere in America, anywhere in the world, to smaller medical institutions who needed who didn't deal with 100 gunshot wounds a year, or incredible traffic accident problems, and actually start to telecommunicate using it. I couldn't get anywhere because on the HHC at that time we were in, but this kind of genius that's out there that could generate enormous profits to offset costs and to improve healthcare is out there. I absolutely agree. That's
and create
untapped.
Jobs in New
No
York.
question.
In industry, in private industry.
No question about it. Well, this was a compromise bill, like everything else. Tell us a little bit about the holes, what you see left undone.
Well, very clearly, we still have 3 million people out there, and we've taken 1 million of the 3 million and made them eligible for the insurance, but obviously there's 2 million out there. The Assembly proposed an original plan, which this is modeled after, which we passed last June, which had a greater percentage of the poverty level. Our bill went up to 200% of poverty. And Family Health Plus, and again, this is a compromise. This is something we were able to get. It's significant, it makes a dent, and hopefully we will improve on it. There's also a program here for small business. To encourage small business, we have done a small part of subsidy in terms of encouraging small business to get into insurance programs. We've created a subsidy pool in order to attack the problem from that end, encourage employers to provide health insurance to their employees. That's very important. We've also done, what we've also done is eliminate anybody from eligibility who was carrying insurance, either employer or employee, and dropped it in order to become eligible. There is a waiting period. So we don't want to overburden the system and pick up new people who used to have other insurance and are now coming into this program. But this is very significant. It makes sense, and we've put it in place so that it's in place for the next 3.5 years. And at that point, I would hope we would reevaluate it and expand it.
Well, already my advocate friends, we always complain. That's part of what we do. I guess one of the things that we're concerned about as we looked at this particular legislation, extraordinarily pleased with what you've done, Mr. Speaker, but seeing that the Medicaid reimbursement rate was allowed to go up for hospitals, but it got frozen for docs and ambulatory clinics, which obviously, particularly in minority and poor neighborhoods, we are just completing a study which found that about 40% of the primary care visits are being done by independent docs, generally in small practices, many of them foreign trained, but still sort of the lifeblood of many immigrant communities. So clearly I understood the constraints here, but this is a cause of some concern with some of the constituents I talked to.
One of the other aspects of the deal that now comes into the budget is the fact that we have, I say, won an agreement not to target Medicaid cuts in the next 3.5 years as part of it. We've also had in the budget a significant assistance to ambulatory care units and clinics that will remain as part of our overall funding of hospitals and clinics and medical care in New York. So I think we had some significant victories there. It may not be everything that everybody would like, but if we did everything, we wouldn't need any advocates like you.
Right. I guess in terms of private doctors, obviously the locking down of the Medicaid rate at the $13 per visit has basically driven out small practices, particularly in areas of central Brooklyn, and turned people into very inefficient emergency room use. And I think it's endangered certainly part of the municipal system, as well as undermining the ability of minority doctors to function.
I agree, David. And I think we have to continue monitoring and examining it and seeing how we encourage people in that fashion.
Let's talk about some of the other things going on. This has been a fairly active legislative session. Certainly key discussions and debates have gone on, particularly about education and other parts of the budget. What do you see in this session, other than the health care reform that's just been undertaken, as significant?
Well, I think one of the most significant things is preparing our children for the future, and education is that investment in the future. Our children are our future. Our children are our future in terms of industry in New York. If we are going to succeed as the Empire State and maintain our status as the Empire State, our children, the children who started kindergarten this year, are our workforce in the year 2015 and 2020. And we must make the investment to make sure that New York's workforce is competitive. It's no longer us competing with New Jersey or South Dakota. It is a global competition. Those children who started kindergarten, they're in that global competition right now. It's the children of Singapore, the children of China, the children of London and Paris. They're all competing with the new technologies, the way communications move around the world. You can have a business here and a billing unit any place else in the world.
It's interesting you should say. There's some real tangible evidence of that. Much of the data entry work has been shipped off shore. India has taken on a lot of the software development work for most of the major banks at this point, certainly Citibank and others. And interesting enough, American Airlines, and I shouldn't, my people come from Barbados. American Airlines has all its data entry done in Barbados and telecommunicated back to their main offices, basically because the training of somebody who hasn't even finished high school or their equivalent in Barbados is so much better than most of the high school kids coming out of the New York City system. So and that's terrifying.
The point I have to make and repeat is we have to get a handle on it. We're not going to produce biotech researchers when we're now dealing with the 4th grade reading levels that aren't up to par. And we have to get a handle on it.
Well, what about? I mean, the issue, the new Regent standards are in place. I think we in the advocacy community support them strongly, but are concerned that at the moment, the legislature doesn't seem to be able to allocate the money to really come up with the resources necessary to meet these new Regent standards. I had some discussions, certainly with members of the legislature, and it was a little disheartening. When we were just talking about capital money, we did a very informal survey looking at the state of laboratory science across the state and found dozens of high schools don't even have operating labs, despite the fact that the new Regents standard requires a laboratory science.
David, I think it's far beyond that.
Yes.
I sponsored a bond act for schools specifically, several $billion.
Yep.
People didn't stand up for it, is what happened. I mean, here in New York City, 70% of the people voted for it, but on a statewide basis, it was defeated. But I found in that experience that those that did have labs had lab kits that were 30 and 40 years old within the schools, but it goes far beyond that. We're talking basics. We have a budget that committed, 2 years ago, we committed to provide universal pre-K in this state to every 4-year-old. And the governor has reneged on that promise and continues to renege on that promise. When you look at the 4th grade reading standards and talk to experts, they'll tell you there are 2 ways to impact it. 1, start the educational experience earlier. You are more likely to have a child reach their fullest educational potential. 2, reduce the ratio of teacher to student, or increase the ratio by reducing the class size. We had a program, the Assembly Ladder Program, which we got into the budget 3 years ago, which the governor and I had agreed to as part of an overall education package. He has not funded that package. It is the law today that we have to step forward next year and put in another increment on class size and on pre-K, and the governor yesterday failed to meet that new commitment.
This upstate, downstate issue, how does it take? Clearly, all the analysis we're looking at from a variety of sources is showing that without New York City's income generation, this state is nearly dead last, I think below Mississippi in terms of income generation. Why can't we make some common cause upstate, downstate? Clearly the kids in the upstate tier are, at least from our very informal survey, are having many of the same problems that my constituents in Bedford-Stuyvesant and Bushwick are having. Why this divide that can't seem to be crossed?
I think very clearly there are political people and political parties that make this divide happen. It's clear they use it, they campaign on it. The last campaign for senator, the last campaign for assembly had Chuck Schumer from Brooklyn.
Right.
I mean, there were a lot of, it was a reference to Brooklyn. There may have been more reference there as far as that. They had Shelley Silver is coming to get your money. You didn't see it here in the city. You saw it upstate.
Yeah, not so subtle.
You saw it upstate on a regular basis, and that was the kind of campaign that people play to. It's unfortunate. It shouldn't happen in the 21st century, but it happens. We are one state. We have tremendous strength, and that's the strength of my Democratic conference. I have to say that I have members who have stood up repeatedly for the city of New York. We don't have a majority in the city of New York. We need the upstate members from Buffalo, from Syracuse, from Rochester, from Utica. They are Democrats, and they stand up for us on issues of education. The parents in Buffalo and Syracuse and Rochester don't want to pay more property taxes in order to have a pre-K. They want the state to provide it, and those elected representatives know it. We are one state. We have great strengths across this state, and we should begin to do business in that fashion.
Yeah, I guess my regret is when the economic downturn occurs, and inevitably it must. I know people don't believe that anymore, but I have an assumption it will, that this incredible wealth that was generated here is probably not going to leave a lot for many working people. It's not going to leave their kids particularly well positioned, as you've talked, against other nations, but even against other states. And I clearly feel it most strongly around the very poor. But as I begin to get a full sense all around the state of working people, this is not going to go well if we aren't able to turn some corner and come up with some kind of consensus.
And I think, David, education's the key.
Clearly.
And the focus of our budget must be on the next generation.
Though I will say, getting back just briefly to health care, I found I come up as a bleeding heart for issues of poverty. and people don't particularly want to talk to me on some of those issues, clearly welfare related. But when it gets to health care, the barriers seem to fall. I think that, and perhaps the ability of you and your colleagues in the Assembly and Senate to reach a compromise with the governor, is indicated by their constituents coming in and saying, what gives? I can't afford even the simplest health care for my kids and family. If we could take education and bring it into the same light, I think, boy, would that be an enormous service.
There is the same mindset, David,
Right.
about education. The problem is that everybody gets very local
Right.
and doesn't look at the global picture. And the global picture is, will New York's workforce be able to compete in the 21st century? It's only if we give the kids and we get the brightest and the best to teach our children. We train our teachers as to the latest techniques, the latest equipment, how to teach children. Very important. And we teach the children so they can compete. That's the only way New York is going to survive, so we might as well make the investment now when you have a $3 billion budget surplus. Make it into pre-K, make it into reducing class size, and provide 21st century facilities for a 21st century education, not require children to count raindrops that are falling through the roof of their school building in order to learn math.
Thank you very much, Mr. Speaker. It's New York's new health plan. If New York's new health plan works, we'll all feel better. But at this point, it's still a leap of faith to believe the program on its own will live up to everything we hope for it. Even if it does, a nagging and significant uninsured problem will remain. We believe here at the Community Service Society that this question will have an enormous impact on every New Yorker. And these millions of people have to be provided with adequate service. So even with the New York Times estimates that an additional 1 million may now get health care insurance, we hope more, this would still leave many more vulnerable to the financial ravages of illness or accident. The United States remains the only developed country where this kind of void exists. 7 years ago, the Clinton health care proposal failed, in part because its goal of providing universal coverage was widely considered to be too ambitious. But with our gross domestic product much bigger than it was even then, it's hard to believe we can't fix this problem. New York's new plan is a step in the right direction, but it's only a limited remedy in just one state. We've got to get to the point in this country where health care is considered a basic right, like education. Then we'll really be able to solve the problem. This is David R. Jones for the Urban Agenda. Thank you.
To comment on the Urban Agenda or for more information on CSS, contact Community Service Society of New York, 105 East 22nd Street, New York, New York, 10010. Area code 212-254-8900.